we as eye doctors were the first in medicine to have independent studies, because the diabetic retinopathy studies, the early treatment diabetic retinopathy study, the MPS, the macular photocoagulation studies, were studies done in the United States sponsored by the National Institute. And we started as the first in medicine to do that. But for many years, we didn't have other studies like this. These are new studies done in similar ways. So the question that these studies were trying to answer was, considering that Avastin is available today and is less expensive than the other one, which is Lucentis, is Avastin less effective than Lucentis? So the other question is in the back of the mind of the researcher is, can we move in the direction of Lucentis, the treatment of AMD, age-related macular degeneration? So it was a very important question. And I think it was really something important, a step forward for ophthalmology. Lucentis and Avastin. Am I clear? Yeah. Any explanation or no? What? Okay. Okay. So the two studies were different. I do not know if you are interested to go deeply inside the studies, maybe not. But I would like to, I know that the attention can be maintained for some minutes. So we will go immediately to the end of the story, and then if you want, we can discuss more. So the two studies were similar. They considered patients with age-related macular degeneration, assigned one group to Lucentis treatment, and the other group to Avastin treatment. And then another group was assigned to Lucentis given on the basis of the need, which means you treat your patient, you see the results, and then if there is still activity, you inject again your patient. And the other group was treated continuously. Are you understanding the difference? So you have the difference between one drug and the other, and then the difference between two different paradigms of treatment. Monthly injections versus PRN, pro renata, which means on the basis of the need of the patient. Okay? So I do not want to go really to make long the story. The results are that Avastin was not inferior to Lucentis. So if you consider the efficacy of one group and the efficacy of the other group, there was no significant difference. So it was an important result because it means that maybe Avastin can be used instead of Lucentis. So the health system, wherever in the world, maybe can spare money using Avastin instead of Lucentis. Okay, and this was for monthly treatment as well as for PRN treatment. This is the first statement. The second statement, unfortunately, is that if you look at the side effects and the complications coming from the two different kind of drugs, there was some difference, which means that the probability to develop some complication probably related to the treatment was higher using Avastin instead of Lucentis. So the problem is, now the real problem is, how much the health system must spare of money in order to justify that you have a higher risk to have complications. I think there is no answer for that. Nobody can answer that. For sure, if you have your mother that must be treated, you will ask for the best, for Lucentis, and it's difficult to say mother, grandmother, uncle, or whatever. I mean, it's difficult to decide when to stop. No, the decision to take the most expensive, the best, instead of the other. There is no answer for that. This is a problem of political choices. Why? Because if I am in Taranto, you know, Taranto is a city in Italy where you have a huge how do you call it, steel factory. And this factory is responsible for a very high increase of number of tumors in the population there. So if you are the politician there, if you need to decide where to assign the finance to treat the population there, maybe you need to assign your finance to the oncologic department, because you have too many cases of tumors, so you must treat them first. But if you are maybe in, I don't know, Perugia or some other place where you have a less important number of tumors, maybe you need to say, okay, we can use this money to treat our patients with eye diseases. And one of the roles that we have as doctors is to advise the politicians where to assign the budget, which is the most important priority for that specific population. I think this is one of the hot topics for doctors today. They need to help politicians to decide where to assign the budget, the financial budget. This is one of the most important problems of today. And the role of doctors will be to explain what does it mean. And what I am asking to Narinder, I was talking to him before, is that we need to be able to say, so look, if you lose one line of visual acuity, this means this amount of money. Because this is really a problem. When you don't see, you are a financial problem. And maybe if we will be able to say one line of visual acuity means, I don't know, $10,000 or $20,000, maybe this will be able to explain to our politicians where to assign the budgets. Because this is not known. And we are always trying to say, okay, please help me. Why don't you give me money for Lucentis? Why don't you help me to do that instead of this? But this is not the right way to go ahead, because the administrator doesn't know if you are saying something true or not. And he is always also considered by the others, the oncologist will ask for treating some kind of tumor and so on. Now we will see the results and we will try to go a little bit inside the data, but what I wanted to discuss with you was this. I mean, to let you know that we as eye doctors have these kind of problems, and we need to try to solve these problems together. The best costs more. And how much can we spend more in order to have the best? This is the problem. And this problem will be more and more important in the future. And we must try to have our mind clear and to know that we need to decide which are the priorities, and we will need to explain these priorities to the people who are in charge of the decision. This is the problem of today. Please.
Is it time for question now? Or?
Wherever.
Okay. I have two questions. One is, how is the situation in Italy now with Avastin and Lucentis? Like, what is charged?
I'll try to explain now.
Okay. And the second one is, is a side effect, the probability of getting a side effect from Avastin, what's the difference in probability, the precise difference? Because in Germany, like the ophthalmologists, when they have to give Lucentis, they do, and in all other cases, they do give Avastin. So it seems that they are okay with Avastin and it's more the probability of side effects.
So in Italy, we had different eras. And we started having available only Avastin. And although there were evidences that Lucentis was an evidence-based medicine and Avastin was not, it was for some years. And then Lucentis was introduced, registered and reimbursed. And it was registered and reimbursed for the official indications that were available at that time, which means the indications based on Marina and Anchor trials, the two main milestones of knowledge in the field of AMD treatment. There were some limitations for treating patients with AMD, visual acuity and the second eye.